Hey, it's Dr. Chris with Macomb Township Chiropractic. We put this class together to answer any questions or concerns you might have going on with care. So let's get going on and talk about us. We've been here about 15 years. I grew up in a medical family. Both of my parents are nurses. After a bad car accident in high school, I had a lot of surgery and physical therapy, and I was going to be a physical therapist. They got me walking again. I was actually in a wheelchair. And at the same time, I had some buddies going to chiropractic school, and they would come home on spring break and winter break and practice on us buds. We were the guinea pigs, and I really loved getting adjusted because it takes the pressure off the nerves that go up to from my neck up to my sinuses. I grew up with these chronic sinus problems. Every month my head was going to explode. Since I started getting adjusted, I rarely ever have those same issues. So that really changed my life. I decided to become a chiropractor. I moved to Atlanta, Georgia, started going to Life University. That's the biggest chiropractic school. When I was there, I found the newest chiropractic technique. That's what we do at the office here. It's called chiropractic biophysics, or we just call it chiropractic rehab. And it's a combination of chiropractic mixed with physical therapy. So it's just what I was looking for, and I think it may be just what you need. So I really became the first chiropractor in Michigan to get certified in the technique, and it's very scientific and specific. That's why I really like it. That's why I think it's going to help you out. So let's get going. And we normally talk about health and how it's your most important asset, because without your health, you can't do those things you need to do, like sleep, like work, like do house and yard work, take care of the family members. Even sometimes bathing and showering is difficult. Recreational activities, exercise. So it's very important to be healthy. Otherwise, you can't do the things you need to do. So we're also going to cover how we're going to help you heal with chiropractic care in the office, and what's normal and what's abnormal on those x-rays that we take, and how those misalignments we find on the x-rays pinch on the nerves and cause some of the health issues you might be having, and how they could cause other problems. Then we'll go over how do we correct it with our chiropractic care. It's our posture rehab program. And then usually after that we go over the x-rays and our recommendations. And when I start the class, I say, if you Google things that can get you healthy, how many pages come up in Google? And everyone says 10 or 100 or 1,000. It's actually 1 billion pages of things that can get you healthy in 0.54 seconds. A lot of things: chiropractic care, eating your fruits and veggies, getting your sleep. If I took all of that healthy stuff, all 1 billion pages worth, and I give it to a dead person, what would it do for that dead person? Nothing, right? Because that dead person is missing what? It's missing life. So here's the moral to the story. We always say, where does health and life come from? In Gray's Anatomy, the anatomy book, on page 4, it says your nervous system coordinates every muscle, organ, and tissue in your body, and it's responsible for all health, all life, and all healing. And this is the foundation of chiropractic care. We call it the brain-body communication. Now, your nervous system is your brain, then your spinal cord, and then the nerves that come out and control every single thing in your body, not just your muscles. So we see people with misalignments and pinched nerves in the neck, and that can cause neck pain and headaches and migraines, shoulder and arm issues, elbow and wrist and carpal tunnel, numbness in the hands, in the ears here, ringing in the ears or balance problems, going up to your sinus issues, TMJ and jaw problems, all kinds, even problems with the eyes. In fact, I've had a patient, while they were coming in under care, they went to the eye doctor. Their eye doctor told them their eyes were getting better since they were coming in the office, and that's pretty amazing. In the mid misalignments and pinched nerves, that can cause mid and upper back pain, but you got your stomach and your heart there. We've had patients that have improvements with reflux and stomach problems. We've actually had patients have improvements with their breathing and their asthma. In that lower spine, we help a lot of people with pinched nerves down in the low spine, back pain, hip pain, sciatica going down the legs, knee problems, sometimes foot issues, numbness in the toes. So we help a lot of people with that. But in that lower spine, the nerves come out and go to your stomach. Patients have had improvements with things like digestion and reflux. got your liver, your gallbladder, your pancreas for your blood sugar, your lower digestion. We oftentimes people have improvements with digestion, like constipation or diarrhea. And then you got your urinary organs down there at the bottom, your bladder. Oftentimes people have improvements with urinary problems, bladder issues. Reproductive organs for the male and the female. It's amazing what can happen when you take the pinching off the nerves. If we can get you closer to that normal, healthy alignment, and take some pressure off the nerves, things can heal better, feel better, and function better. Now, when we talk about healthcare in America, it's not always so healthy. The U.S. is 7% of the world's population, but we take 75% of the world's drugs. So that's a little off if you ask me. But the problem is the U.S. is usually last in the rankings for the healthcare of the industrialized countries, which shouldn't be the case because we spend the most money on healthcare, more than any other country, so we should be number one with healthcare. So kind of sometimes that tells me maybe drugs aren't the answer. If they were, we should be a lot healthier. And just some common drugs and what they do, like blood pressure medicine. Different causes of blood pressure can be stress, too much salt in the diet, not enough exercise, overweight, drinking too much alcohol, smoking cigarettes. Now, if I take a blood pressure medicine, what it does is it dulls my nervous system. It dulls my brain to bringing my blood pressure down, but it doesn't really fix the cause of the high blood pressure. If you want to fix the cause of it, you got to be less stressed out, eat less salt, lose some weight, exercise more, drink less, stop smoking. But if you just take that pill to cover up the side effects, that cover up the high blood pressure, but it doesn't fix the cause, that'll definitely cause more problems down the road, and you can end up having more problems, and it will catch up to you. And then every drug has multiple side effects. If you don't believe me, go to drugs.com, type in any drug, and you'll be shocked at what you see when you scroll down. So use that as a good resource, drugs.com. Antibiotics kills that bad bacteria, but it also can kill that good bacteria in your stomach. And that good bacteria helps your food digest, but also a big portion of your immune system, 60 to 70% of your immune function comes from your good bacteria too. So a lot of people who take a lot of antibiotics, they end up with digestive problems and a lowered immune system. So that's really not good during the pandemic, right? And definitely sometimes drugs can even cause more problems than you're trying to fix. And before you know it, you got to take another drug for this problem and then another drug for that problem. And I've had people in my class stand up and say, yeah, I'm taking 10 or 20 different medicines, and that's not normal or healthy, so we want to avoid that if at all possible. And the anti-inflammatory drugs and the painkillers, those are the most common ones we see, and they're going to cover up that symptom of pain, but they're not going to typically fix the cause of the pain. And pain's like a fire alarm going off in your body. Your body's trying to tell you there's a problem. Find the cause of the problem and let's fix it. Or find the fire, put out the fire, okay, which is causing the fire alarm to go off. Now, if I just pop that anti-inflammatory, the painkiller, it's like pushing the button on that fire alarm there, but not putting out the fire. And so if we keep doing that, we're going to burn our house down here. Let's fix the cause of the problem instead of just covering up the symptom. And that's what we want to do in the office here for you. And let's just talk about some drug statistics for things like Motrin, aspirin, Advil, Excedrin, ibuprofen. Those are all NSAIDs, non-steroidal anti-inflammatory drugs. And NSAIDs kill almost 20,000 people every year just from bleeding stomach ulcers. And that doesn't even include how many people die and have health problems from the kidney problems NSAIDs cause. And then Tylenol, Tylenol is acetaminophen. That's one of the leading causes of liver failure and liver transplants. Now, that's over the counter. All right, you can get that in any drugstore, grocery store, gas station. Now, the prescription drugs, just cause a lot more problems too. Almost a couple 100,000 people die every year from taking properly prescribed pain medicine, and that's just crazy. So So what we want to do is try to get you closer to a normal, healthy alignment, straight from the front, with good 40-degree curves from the side there. The closer we can get you to that normal, healthy alignment, you can heal better, feel better, and function better because there's less pinching on the nerves. Now, we do use our state-of-the-art technology, and that's our postural digital x-rays to try to locate where you might have any misalignments or nerve pressure pinching on the nerves, which could be causing a lot of those issues, okay? So let's show you an example. Here's a young lady, this little girl. You can see how she shifted over to the left side. This is her low back x-ray. It should be nice and straight, and that red line's where her back was, so it shifted to the left side there, and that's a scoliosis. She's got pinched nerves. She's having back problems at 12 years old. Now, if you look at this x-ray over here on the right side, we got her a lot closer to that normal healthy alignment with our posture rehab, or we call it corrective care. We want to correct the alignment. And from that first x-ray there, her mom actually took her to multiple chiropractors, physical therapists, even some orthopedic surgeons before she brought her to our clinic. You can see by that x-ray they didn't fix anything. So with our posture rehab, here's what we do. So if you're shifted to the left, what we do is we shift you into the opposite position. So we shifted her over to the right, and with time and repetition, with postural adjustments and postural traction, we retrain the brain, we retrain the tissues, kind of like the braces on the teeth, got her a lot closer to that normal healthy alignment, takes the pinching off the nerves so you can heal better, feel better, and function better. And she did a lot better after we made those corrections. Now, you see how her neck from the side here, how her head's going forward like that. So this is the neck x-ray on the bottom here. There's that normal 40 degrees, that half circle there, 40-degree arc, and the red line is on her spine. So it was going the wrong way. And on the right here, we made a great change. We corrected that neck alignment. Here's the thing about her neck, though. She didn't have any symptoms yet, like neck pain or headaches. But the thing is on the left here, if we would have left her like that, she's definitely going to have some problems down the road. So we corrected that, because you should never judge your health by how you look or feel. You can have misalignments and not feel a thing, just like her neck was out of alignment, but it felt fine. You can also have stage 4 cancer and not feel a thing too. But if they find it, they better fix it. So if we find anything abnormal and unhealthy in your spine, out of alignment, that can cause nerve pressure. That can cause other problems down the road. And in addition, she was younger. You can have problems happen when you're younger, big traumas and little traumas, and then you might not even feel them for 10, 20, 30 years later. So ultimately, we want you to have the proper alignment, proper structure. Okay, if we can get your spine and posture closer to normal alignment, can take the pinching off the nerves, things can heal better, feel better, and function better for long-term health. A couple of things that can happen when you're out of alignment. So on the left here, that's an x-ray of the spine. There's that normal 40-degree arc. In between, you got your bones in the spine, and you got your discs in between the bones there. And now, where this dotted circle is, the yellow circle, that is a thin disc. That's disc degeneration, or that's another name for arthritis in the spine. If the spine's out of alignment for so long, it'll wear down and degenerate. Arthritis will set in. We got to avoid that from happening. That makes it very difficult to fix. But they can also bulge and herniate. This is an MRI, so these are disc bulges and herniations. The other problem is bones can start to form spurs. Your body pulls bone to wherever the most stress is on the spine or on bones. So when you're out of alignment, those high stress areas, bone spurs can form. It can want to start to fuse together. And then if that happens, the orthopedic surgeon may want to get in there and do surgery. With neck or back surgery, though, 50% of the time you end up the same or worse after the surgery. And 75% of the time, most people have to have another surgery within about 5 years. So those are not good odds. So let's try to get it, feeling better, healing better, and correct it. But if there is a disc issue, we do have a special treatment. It's called disc decompression therapy, and it gently separates the bones in the spine. And it can create a suction in the discs. It can open the discs up, pull some of those bulges back in, pull nutrients and fluid and water into the disc, and pull some pressure off those nerves. So we can help the discs and really take some pressure off the nerves, but we still have to correct the structure, the alignment. So here's the normal healthy alignment on the far left here, a good 40-degree curve. You got good block-shaped bones with nice plump discs. When it's out of alignment, that's stage 1. It pinches on the nerves. Your body doesn't like that. That's not healthy. Stage 2, the discs start to wear down, and that's arthritis setting in. Stage 3, the bones start to get pointy, bone spurs form, and then stage 4 is where they start to fuse together, and then I might not even be able to help you if it gets to that point. So wherever we find you on the stages of spinal degeneration, our number one goal is to stop it from getting worse. If we can get you closer to that normal alignment, with time and repetition, with our postural rehab, and correct the alignment, things are going to be much better off for the future. And then how did you get this way? Big traumas like falls, car accidents, sports injuries, and little traumas like, those little repetitive things you do over and over and over and over the years. Okay, it can start when you're little too. And even there's birth trauma can happen. The doctor can pull almost up to 90 pounds of pressure on a baby's neck trying to get that baby out. So sometimes that can damage, a baby's neck. When my little girl was born, her head was stuck to the side like this. It's called torticollis. And I started working on her when she was just a little baby, just bringing her head to the opposite side, using the nerve gun to stimulate the nerves to tell the brain, we want you over here on the opposite side. With time and repetition, we got her little head on straight. But imagine if she was stuck crooked like that growing up. That could affect her development and other problems down the road. The other thing we want to do is check kids out for a scoliosis to make sure if they have the scoliosis, as the twig is bent, so grows the tree. We need to make sure we correct it before they have a growth spurt, because that can make the scoliosis get way worse and sometimes end up having a scoliosis surgery, which they screw all these rods in their back. It's horrific. So that's one of the other reasons why we want to check kids out. But we want healthy kids to grow up to be healthy adults, and it's easier to fix kids than to repair broken adults. So now there's two types of care. Relief care is like traditional chiropractic care. We can usually get you feeling better in 2 to 4 weeks, a handful of treatments. We know how to get people feeling better. We've been around a long time. The problem with traditional chiropractic care is I can't correct the alignment in that short amount of time. That'd be like taking the braces off the teeth after a month. And your teeth are bones, really. And so, what does it take to correct the alignment of the teeth with the braces? Well, it takes more than just a month or so. It takes time and repetition. So we do corrective care, and that's what the neuro research shows, the newer techniques. We want to get you feeling better. Then we're going to do our posture rehab. We're going to do postural adjustments and put you in the opposite position and use the nerve gun to retrain the brain, and also postural traction holds you in the opposite position to retrain the tissues, like putting the braces on the teeth. All right, and with time and repetition, we can make some good changes in the alignment correction, and then we want to prevent it from going back and maintain those corrections. That's the last phase of care, preventative maintenance. Just like when they put the retainer in after you take the braces off the teeth, it prevents it from going back. And we want to maintain those corrections because the nerves really are a slow healing part of the body. They take a long time to heal. We oftentimes continue to see people continue to heal for months and years as time goes on, depending on how long it's been there. Now, what can you expect with care? Healing takes time and repetition. Rome wasn't built in a day. It took longer than a day to get this way. Now, the worse it is, the longer it can take to feel better and to fix. All right, and the younger we are, the better we heal. So it's going to be much easier to fix it now rather than 1 year, 5 years, 10 years down the road. You can have good and bad days, whether you worked hard, played hard, slept wrong. Even if you have pinched nerves, your nerves are more sensitive. That's why you can feel the weather pressure front coming in, putting pressure down on your sensitive nerves. If you have a bad day, just let me know. We can tone it down and switch it around. And you got to use the ice packs, and then we can get you back on track. But everyone has good and bad days, and sometimes good and bad weeks. Last point here, consistency equals success. I have a patient, he's a marathon runner. When he first came in, he could barely walk, let alone run, but we got him feeling better, we fixed it, we maintained it, and then he ended up running the Detroit Marathon, so we were all proud of him with that. When he's training for his marathon, he usually runs like 3 or 4 days a week to build up his speed and strength and stamina. But what if he only did that once a week or every other week? It's really not as effective as if he were more consistently training. And the same principle applies to this type of care to getting you feeling better, healing better, correcting it, and maintaining it. The patients who are the most consistent with the treatment schedule we put down for them, they have the best outcomes and the best results. Lastly, please be on time or reschedule. We have everyone strategically scheduled, but if you have to come a little earlier or a little later to your appointment, just give us a call or a text, and then we'll make sure we get you in the proper time slot. But if you just walk in out of the blue, you might have to wait around for a little while. And last one, we are still doing the $20 special. If you have any other family members, friends, coworkers, neighbors that you think we could benefit them, just give them our number. You can take a picture of our business card and text it to them. Grab any brochures in the office. We have the testimonial sheets with those specific testimonials on there of patients who've had great success. I can even give them a call if you want me to. We can also set up a lunch and learn at your place of business and bring free lunch for the office there. If they're okay with it, after the pandemic. So we're okay with going out and spreading the gospel of chiropractic care and trying to help as many people in the community as we can. So that's our mission. So if you could help us on our mission, please send in your family members and friends and coworkers so we can help as many people as we can with health and healing.